Hey, Joan. So today we have a client. Her name's Mary Lou. She's signed all her consents, so she's willing to participate. She acknowledges that she's going to follow up with her family doctor after this consultation. So she's 45 years old. She appears to be 25. She has 2 teenage daughters who have been a little bit out of hand lately, but also her mother's died. Her mother's been a pretty strong support in her life, but she's had increased symptoms of depression, anxiety as well. In the past, she has been diagnosed with bipolar disorder by her family doctor. She's never seen a psychiatrist, had any hospitalizations or ER visits for mental illness. When I saw her, she never really described any periods of mania or hypomania, so it was hard to really assess that retrospectively. But she does have a couple of days where she does feel, happier than usual. She needs less sleep. She'll be more motivated to do certain tasks or projects. But she is quite open to treatment. She's interested in having her medications reviewed. Presently she's on Effexor 150 milligrams once a day, which doesn't seem to be helping too much. She doesn't take anything for anxiety. And then she's also open to doing counseling as well.
Okay, well, that's probably enough information for me to get started, so you can bring her in any time.
Great, okay, thanks, Joe. So Mary Lou, as we discussed, this is Dr. Nagy. She's our staff psychiatrist. Yeah, you can sit right here. So when you're talking to the doctor, just wait about a split second for her to stop talking before you start talking, just because there is a split second delay. It is a live interview, and it's not being recorded in any way.
Not recorded?
Not recorded, yeah.
Okay.
Okay. So Joan, this is Mary Lou.
Hi, Mary Lou.
Good morning.
Hello. I'm Dr. Nagy, and I just wanted to let you know before we start that even though this is a little bit of an unusual way to assess somebody, after a few minutes it seems to work pretty well. And we all forget that there's a screen between us. And also to let you know that I've had a chance to talk to Brian, and I've had some material from your family doctor, so I'm pretty familiar with what's been happening up to this point. So we don't have to go through your whole history.
Okay.
Is that clear?
Okay.
So for today, I just want to make sure that we have a chance to talk enough so I can understand exactly what you're most concerned about. So to start with, I've heard that you've had a significant loss and there's a lot of stress in your life right now. Is that?
Yeah, my mom just passed. My mom just passed away, and I think my kids are trying to kill me.
Your kids are trying to kill you?
Yeah, they won't behave.
Yeah. So that's pretty stressful.
Very stressful.
When did you lose your mother?
6 weeks ago.
Only 6 weeks ago?
Yeah.
And what kind of relationship did you have with your mother? Were you close?
Oh, we spent all our time together. I don't work, so I was with her all the time.
So this must be a pretty difficult time for you.
It's pretty lonely. I don't sleep.
Okay, so Mary Lou, we've been talking now for quite a while, and I appreciate how open you've been, and I think I have a fairly good understanding of what's going on. And to start with, you have a lot of stress at the moment with the children, being on your own, losing your mother. I think that's, from what you were saying, the most important concern you have. In addition to that, we talked about your diagnosis that you were given, and that we can start a small amount of a medication just to help you with your sleep for a little while, but that's just short term. And what I'd like to do is to send a report to your family doctor with all of these suggestions, and then your family doctor can talk it over with you again. You can ask any more questions you have at that time. Does that sound reasonable?
That sounds good. Thank you.
Okay, well, I'd just like to say a couple of things about using the PCBC. To start with, much more user-friendly than I would have imagined. And, it allows me to do consultations remotely, and so far that seems to have been quite effective. Since I have follow-up as well, I can speak to the nurses who refer afterwards if we need to make any changes. But the actual interface is quite comfortable and convenient, although sometimes people seem initially a little bit awkward or uneasy. That passes quite quickly, and I don't really feel that very much is lost using this system compared to a face-to-face encounter.